I'd like to welcome everyone to the season 2 of your Dairy Best Heifer. We are actually in our final webinar of this season today. So please stay tuned for upcoming programming in 2026. You can follow the ISU Extension Dairy team on social media platforms, including Facebook, LinkedIn, Instagram, your platform of choice. You can find us on YouTube, and you can find all recordings of our this webinar and others on our YouTube channel. You can also check out our website and sign up for our monthly newsletter. There are all sorts of ways to stay in touch with some of the things that we've been working on. So if you've been enjoying this season of your Dairy Best Heifer, stay tuned for what we have coming in 2026. However, today we are excited to welcome Dr. Pamela Adkins from the University of Missouri. She is an assistant professor there in food animal medicine. And sorry, I had to close your bio when I was messing around with those PowerPoint slides, but yes, Pamela is a graduate of the University of Nebraska-Lincoln, where she received her bachelor's degree, and The Ohio State University, where she earned her master's and DVM. She completed an internship at The Ohio State University and a residency at the University of Missouri. She joined the Mizzou faculty in 2015, and her research interests include bovine mastitis, molecular epidemiology of infectious diseases. Her clinical interests are food animal internal medicine. We are excited to hear from her today um, as she discusses heifer mastitis. So with that, I will stop sharing and I will allow Pamela to take over the screen and take us away. As she's doing that, I will be, oh, I can stop sharing. There we go. As she's doing that, I will be putting a link in the chat with a evaluation that you can fill out to help us understand the value that we got out of our program today. I'll also be putting a copy of the presentation into the chat as well. So, Pamela, take us away.
Thank you. I was trying to stay muted because the fire alarms are going off, or the test things are going off here. And so I was hoping to prevent you from having to hear that, but it's not done yet.
Ours are at 10 a.m., so yours must be a little behind ours.
So anyway, I apologize, but that's maybe one more time around. I'm excited today to be talking about heifer mastitis. It's a topic that I get really excited about and love to have conversations about. So I hope that at the end of this presentation, if anybody has questions, I would love to chat, and hopefully some of this discussion brings up some questions. So please, I look forward to that part. This is a picture of some of our heifers here at the University of Missouri Foremost Dairy Farm. And I was having some PowerPoint issues, but hopefully we are going to work through this. So this is just an outline of what I'm hoping to cover today. So first, I just want to make sure we're all on the same page regarding just mastitis in general, and then we'll go into heifer mastitis, the definitions, why we care, how we define heifer mastitis, prevalences that we know about, risk factors, and then some considerations for prevention. Unfortunately, we don't have all the answers for all of these topic areas, but I'm hoping to cover at least, some of it, and hopefully bring some discussion forward for everybody to consider. So in general, when we talk about mastitis, we often talk about mastitis and intramammary infections. So just a little reminder, mastitis is inflammation of the mammary gland, and it's diagnosed by indicators of inflammation, which oftentimes includes somatic cell count when we're talking about subclinical mastitis, or abnormal milk, as noted in this picture here, because in the case of clinical mastitis. While mastitis is most often associated with an intramammary infection, sometimes they don't go completely together. So an intramammary infection is the presence of an infectious agent in the mammary gland, most often bacterial, but as you're all well aware, sometimes we see things such as viral with avian influenza going around. Sometimes we see things like prototheca, which is a whole other bag of worms to digest. But most of the time, it is bacterial. It's most often diagnosed by culture of the agent from milk, or sometimes we'll do PCR, but generally we collect those samples from milk from cows. As I said, mastitis is most commonly caused by intramammary infections. And so in some of this discussion, I may use those interchangeably, but obviously one is more inflammation and one is more associated with the agent itself. When we get into heifer mastitis, the definition of that is subclinical mastitis, clinical mastitis, or a non-functional quarter in an animal before or during their first lactation, and most oftentimes referring to that periparturient period. Obviously, if you get into semantics, once they're a first lactation animal, they're not heifers anymore, but you all know we all call them heifers. And so in general, it's just around that first time period of their first lactation, but also any time before that as well. This is a picture of some teats that from a heifer that we were working with in some of our heifer mastitis studies. And as you can see, that the gland of a heifer obviously is much different than that of a lactating cow, and alone just brings into just looking at it alone can often bring into the picture of that mastitis in a heifer is oftentimes very different from that of a full lactating cow. So in general, why do we care? Well, mastitis, as everyone knows, is the #1 disease of dairy cows. It is an economic concern, a welfare concern, a productivity concern for cows in general. And obviously, all of those expenses that we deal with mastitis as a whole are also factors in heifers. So whether that be lost milk production, antimicrobial usage and residue avoidance, veterinary fees, management, labor, all those things are a factor for heifers as well. But just in general, when we think about heifer mastitis, there are some costs that maybe are more if we're thinking about the fact that this animal has not made us money yet and is in the beginning of her milk production stages, and we're already losing productivity from this animal. So it's been identified that an animal with an increased somatic cell count in the early parts of their first lactation, those animals produce less milk throughout that first lactation, and many times have decreased milk production throughout their lifetime milk production. And so we are starting out of the gate not performing as well as we could, which obviously can be quite expensive. We also have an increased risk of premature culling. And obviously, again, if we're culling 2-year-olds, we're not making money back on the price of raising that animal. So mastitis alone can be expensive, but in heifers, you potentially have increased losses. So while mastitis always is important, we need to think about why is mastitis in heifers different than in cows. And if we look at the incidence rate of mastitis, especially clinical mastitis in heifers, we do see some differences than what we would identify in older cows. So this is a table or a figure from a study that was done in New Zealand, and looked at the incidence rate of clinical mastitis, and the dots are the heifers and these little diamonds are the older cows. And you can see there's a higher incidence of clinical mastitis early in lactation in heifers compared to older cows. If we look at it, New Zealand obviously has a lot of grass pasture-based dairy system, so a little bit different management system than many of us in the US, although we here in Missouri do have some pasture-based dairy systems. When we look at it, the similar data, this is out of Canada, looking at free stall barns as well as some tie stall barns, we see the same picture. So this is some data out of Canada where the circles are the heifers and the diamonds are the older cows. And you can still see in the first few days of lactation, we have a much higher incidence of clinical mastitis in heifers compared to the older cows. And so with that, I think it's really important to consider the fact that if it's happening between 0 and 2 days in milk, it's likely that those heifers acquired those infections prior to the onset of lactation, and therefore a lot of our focus potentially needs to be before lactation, and therefore different focuses than what we would consider in lactating cows. Oh, there's a little circle to point that out. When it comes to intramammary infections, we know that heifers, we can culture a lot of bacteria from heifer mammary glands, whether that's before calving, so prior to calving, 29 to 75% of quarters can be positive, at first calving, up to 88%, and in early lactation, up to similarly 80%. That's quite high if you think about it compared to older animals. For example, if you go in and do a whole herd culture of all animals throughout all stages of lactation, we usually expect that maybe 25% of quarters would be positive. We know that animals generally in early lactation are more likely to be positive, and if we do cultures of all age groups, we oftentimes in early lactation will have maybe a little bit higher of about like 30% of quarters that would be positive. So comparatively, these positive quarters from heifers prior to lactation and early lactation are higher than what we would expect in older cows. This is just looking at what's causing this mastitis in heifers. And this is a breakdown of you can see on the left side, the different names of the different bugs that we can culture. In the middle here is the primiparous or the first lactation cows. And on the right side is the frequency and percentage of positive samples in older animals. And you can see that in general, we have some things that stand out that are commonly positive in both groups. So just to highlight that, you can see the non-aureus staphylococci are more frequently positive in the first lactation animals compared to the older animals. We have Staph aureus shows up high on both groups. You can see that in general, the frequency is higher, or the percent positive is higher in the older animals than in the heifers. And while that's expected with the contagious pathogen, it's still a bit alarming sometimes how many heifers can calve in with Staph aureus. And then the box that's highlighted in green would be the environmental pathogens that we see. And while they're not at the top of the list, they do make up a large percentage of everything else below that, and therefore need to be considered as well of some of the environmental risk factors that should be evaluated in heifers and what we can do to prevent these organisms. So just a little bit more specifically, this is looking at a breakdown of 2-year-olds, so first lactation animals compared to older age groups. And again, this data is from New Zealand. So strep uberis pops up here quite high. That's the diagonal hash mark group. And you can see that's high oftentimes in pasture-based dairy systems. So while we do see some in non-pasture-based dairy systems, those numbers would probably be lower. Things that I think are striking to see on here is, again, you can see the black boxes, which is the other staph species, are quite high in the 2-year-olds compared to the other groups. And then similarly in this data set, Staph aureus, which is the second box, is lower in the 2-year-olds compared to older cows, but still present in the heifers. So just to give some information about each of these species that we see commonly in heifers, the other staph group, I oftentimes call it NOS, or non-aureus staph. So I'll talk about Staph aureus in a minute, but obviously Staph aureus is a major pathogen, but we see 50 plus species of other staphs that we can identify on the dairy farm that we tend to group them all together. So if you're not Staph aureus, you're in this other category of non-aureus staph, or used to be called CNS or coagulus negative, or I many times just call them others. They are generally considered minor mastitis pathogens. And the reason why they're considered that is because they usually cause only a minor inflammatory response. and maybe minor to no impact on milk production. And so they get grouped together as that. But I think the thing that's really important to consider is that we do find them a lot. And if you're sending milk cultures off to a diagnostic lab or a milk lab that uses a lot of the modern technologies that we have available for identifying bacteria, you will see a lot of these names pop up potentially on your reports. Where like things such as Staph chromogenes, Staph xylose, Staph simulans, which are other staph species, and they can be identified in cases of clinical mastitis or subclinical mastitis. A lot of times people are asking what to do about it. And that's something that I will get to a little bit later in the presentation. But in general, they will cure. They oftentimes respond to antibiotics in clinical mastitis cases. And so definitely categorized as minor, but definitely very highly prevalent. And if you look at this table here, this figure, you can see that Staph chromogenes, which is the ones in red, is really highly prevalent in first lactation animals. And we'll come back to that again as well about some information about Staph chromogenes specifically. Staph aureus we categorize by itself because it is a major mastitis pathogen. It's known to be contagious. It's known to be associated with chronic mastitis that's oftentimes not treatable, and it can cause some significant impacts on somatic cell count and milk production. And so it is an important pathogen for us to consider always. And in some parts of the country, we are seeing it less frequently. So some mastitis research workers find it less commonly in their area. In my area here, maybe a little bit of the south, more humid, hot area, we find it on most dairy farms. We find some at least. And it is a concern that we need to continue to focus on to try to help improve milk quality on these farms. In older cows, we consider the parlor the major concern of where this pathogen is coming from. We know it can be contagious, spread from cow to cow, and we think about that happening during milking time. And so obviously that's not happening yet in heifers, and therefore we need to think of other factors that are important in heifers. So there's some old data, and there hasn't been a whole lot of newer data out there on where Staph aureus can be found in heifers and where these infections are coming from. So you can see here when people culture the milk, the colostrum, the udder skin, and just other skin sites on cows, we can find Staph aureus on the body sites and in like the teat canal, the teat ends, all the animal associated sites, we can find it. And so therefore in heifers, it's thought that the body sites of the animal are an important source of Staph aureus. And again, we're going to talk about this a little bit more as we carry on with other recommendations, but colonization in general seems to be a risk factor for heifers. This is older data by Larry Fox from Washington State University, so much so that like the table doesn't even show up well on the paper. But you can see this is a study that his group, they did looking at Staph aureus in heifers in different locations throughout the country, as well as different seasons. And we do see differences. We know that there's differences in prevalences from herds. And so like management systems and seasonal factors definitely seem to play a role. And here, for example, you can see that the farms in Louisiana, the Staph aureus is the first black box. And like there was a higher prevalence of Staph aureus in Louisiana compared to other states, and also tend to be higher in the fall and spring seasons compared to maybe summertime. And so factors, seasonal factors, management factors, location factors seem to play a role, which is something that we continue to see to today. For example, we deal with heifer mastitis in this region here, not so much as I think some farms in more northern states aren't dealing with it as much as we do. And so there's some risk factors that need to be determined. So intramammary infections happen, right? So we know that 29 to 75% of quarters can be positive prior to calving. And one question that I tend to think too much about is, when does that happen? So, we have this tiny little baby calf all the way up to this, pretend this is a heifer that wasn't dehorned. That, when was that infection occurring? When did her gland become colonized? And for me, that's a really important question, because I need to, in order to be able to prevent it, I need to know where we should focus so that we can implement prevention strategies at the right time points to help reduce infections. So something that we've worked on a little bit is trying to figure that out. So this is some data from our lab group looking at percent prevalence and positive quarters from different age heifers. And this is something that's been done a little bit before, but we repeated some of it and used some new techniques, which I'll talk about here in a minute. But you can see here that the pregnant heifers, so we have this age group of pregnant heifers divided into late, mid, and early gestation. And then we have non-pregnant heifers, young and mature. And you can see that the pregnant heifers, the positive quarters were a lot higher than in the non-pregnant heifers. And so following what others have found previously, we know that gestation and development of the glands associated with pregnancy seems to be a risk factor for increased prevalence of intramammary infections. That said, we do still see positive quarters in these young heifers. So we had animals as young as 6 months old where we were able to culture bacteria from. One thing that we were not able to follow or fully assess in this study was if those infections cure over time. So in cows, adult lactating cows, we know that a lot of intramammary infections happen. We are never fully aware of it. Maybe we see a blip in her somatic cell count, maybe, but it cures on its own. A lot of intramammary infections self-cure, and it's possible that some of these as well could self-cure. Furthermore, on the flip side of that, some of these young heifers did have things that would be considered major mastitis pathogens, and trying to prevent those from happening at a young age is important because the gland still needs to develop, and there's a lot of growth and development occurring that we don't want to interrupt with having an infection on top of that. So important to kind of figure out what's going on with these young ones, but definitely the gestating animals have a higher prevalence of intramammary infections. So a question that can, further, maybe drive one crazy is how you define an intramammary infection in a heifer versus a cow. These are just some pictures of what we normally do to define intramammary infections. We go into the parlor, we prep the gland, we take an aseptic milk sample before milking, and we are able to get milk that we can then culture and determine that bacteria is there. We can't do that in most young heifers or even heifers in early gestation because there's just not enough secretion present in the gland to be able to get those samples. And so truly finding a way to decide what is a positive sample is something that we struggle with. And one factor that makes it complicated is when you look at the anatomy of the teat, we know that a lot of bacteria hang out on the skin of the teat, and a lot of bacteria hang out just in the teat canal or the teat sphincter. And they don't necessarily go up in the gland. They just like hanging out, colonizing, doing not much. But if we just culture the end of the teat, we can find bacteria that maybe aren't causing a problem, which complicates our definitions. So in heifers, something that we've looked at and others have looked at in the past is, do we do teat canal swabs where we just take this very tiny swab into the teat end? Is that considered positive? Do we try to get secretions? We know that if we're able to get secretions, more of those are positive, but we're not always able to get secretions. Or what we've tried are needle-based methods where we're bypassing the teat end and going directly into the glandular tissue to either get secretion or just some cellular debris to culture. while this is interesting for a research perspective because it's bypassing the teat end and colonization of bacteria, I would make the caveat that this has not been validated. And I must always say that I do not recommend everyone stick needles into glands of their heifers. Please, please not yet. And maybe with some help. So it needs to be validated. And we're currently only using it for research. I put this picture here because when we do this method, we provide some sedation for the heifers. And these are where girls were a little sleepy at the end of that. But we sedate them and try to make it as least painful as possible. And like I said, I need to validate it to determine if we're finding bacteria in the gland with our needle-based methods, whether or not that's repeatable or found when she enters lactation. Because what we truly care about is it impacting the growth and development of the gland? And does she have an impactful infection that's having a negative impact on her milk production? And those are things that we're still working on defining. Okay, so we know heifers have intramammary infections, but what are the risk factors? And as with mastitis in general, we know that management is the major things that we need to focus on with regard to risk factors. Many heifers are raised in different ways in different parts of the country or different parts of the world, some of them being housed, some of them being out on pasture-based systems. And so I'm going to go through several different risk factors that have been identified, and some of these may apply to some farms more than others. But hopefully it's at least some food for thought of things to consider on your operation. So one thing, like big picture to think about, is that in general, when udder health is at high quality on a farm overall, heifers tend to have less mastitis. So when producers focus on good management systems of all their cows, the heifers fall in line with that and tend to have less mastitis. So a low bulk tank somatic cell count herd tends to have less heifer mastitis. And so that's great. You know, if we're implementing good management strategies, and we know that can help with our lactating cows, hopefully we're also managing our heifers appropriately, and that all goes downhill and we're having positive impacts for everyone. I think some of these other things kind of fall in line similarly to that. So culling due to udder health in general, when that's less commonly done, we have lower levels of mastitis and then therefore lower levels of heifer mastitis as well. So just big picture, when we're culling a lot for mastitis or we have high bulk tank somatic cell count, we tend to also have heifer problems. Automatic milking systems, I'm a fan of. I think they can be great, but they obviously do not replace management. And sometimes automatic milking system herds have poor udder health. And that's something that's been reported around the world. And I think that it just is difference and management strategies that need to be adopted for these herds. Sometimes some automatic milking systems have not as great of teat cleaning or maybe poor detection of mastitis, and those things could lead to potential spread or potential just higher bulk tank somatic cell count. And then also sometimes on automatic milking systems, it's been found that milk leakage can be a problem as well, which then puts cows at risk of mastitis. So those are just herd-based things to consider with regard to risk factors that are important for cows as well as heifers. Other things to consider with heifers specifically, interestingly, is it goes all the way back to the newborn calf, is that herds with SOPs for colostrum feeding have less heifer mastitis. And whether that's associated with just starting off with good immune system, or just these herds tend to also have more heifer management protocols specifically in general, these things tend to correlate, and we see better heifer udder health in these herds when they also have better colostrum management. So that's something to consider, is just overall health of the heifers. Other things to consider would be cross-suckling. Many times there's growing redeveloped concern about this with regard to like paired housing or group housing of heifers. I'm sure that's something that's been discussed throughout this seminar series. And I know that many think that as long as the diet's managed appropriately for these calves, that cross-suckling shouldn't be as big of a problem, but definitely something to consider. Obviously, cross-suckling can cause damage to the teats and to the tissues, which then would put heifers at risk of mastitis. Fly control is something that I'm going to talk about several times throughout the rest of this presentation. Flies can carry pathogens, and it's been well documented that flies can be positive for many mastitis pathogens. We see flies move from teats to teats, and they can move pathogens around from animal to animal. Contact with lactating cows prior to calving has also been identified as a risk factor in some studies. There's some studies that can't repeat that, and so unknown if it's some other management factors also that need to be identified within that, but maybe it's stress related, maybe it's pathogen exposure that are playing a role when heifers are exposed to lactating cows. And then another major risk factor specific for the heifer, but probably cows as well, is time in the calving area, where less time is better. Calving pens tend to be pathogen loaded in general, and can definitely be a risk factor for mastitis. Other things just in general are poor heifer hygiene. If we have dirty heifers, we have dirty glands, and we can be colonized with lots of bacteria. Lack of mineral or vitamin supplementation or appropriate diet formulation for the heifers can be a factor. Udder edema, I'll talk about a little bit more as well, can be a factor. And then interestingly, non-aureus staph or those other staph, colonization with those bugs potentially is protective, which again, I will also comment more on that in a minute. So when it comes to fly control, we know that, so this is a study that's looked at samples that were positive for Staph aureus collected from different dairy farms. And you can see that there's a fair number of samples across the spectrum that are positive, whether that's colostrum, the mouth, the nasal area, the water, that can all be positive. Human hands, definitely. But ones that were high on several farms included the teats. So the teat skin itself can be quite highly positive for Staph aureus, and then also flies. And this study identified that flies can be positive, but there's many other studies since that have identified that flies can be positive and that flies can be carrying the bacteria that we then find in the glands of heifers. And so fly control is a vital part to trying to control Staph aureus movement in among heifer populations. This is just showing the little flies, and I think that sometimes we have a tendency to look at the sides of the calves and the faces of the calves to identify fly numbers. But sometimes the horn flies are definitely causing damage on the teats, but maybe in lower numbers elsewhere. And so we need to be sure we're looking at the teats specifically. So you can see in this picture from a study that photographed the flies on the teats. This is from our own work, where you can see the damage to the teat end and the reddening that was identified under some fly bites that can be obviously cause inflammation, irregular skin, which leads to bacterial colonization and then leading to intramammary infections. This was an evaluation of, okay, we think flies are a risk factor, so what if we control for flies? Does that help? And in this study, they did see improvement. So you can see that the black, these were teat scores, but they did the black were before fly treatment and the white is after fly treatment. And there was an association with IMI and somatic cell count from the impaired teat skin. And so with after treatment, the reduced prevalence of teat lesions likely associated, hopefully associated with reduced prevalence of intramammary infections. That's the next piece of the study that'd be nice to have is that, but we do know that we can see improved teat skin with the treatment, with fly treatments. Udder edema has been shown to be linked to somatic cell count, and reduced udder edema is associated with reduced somatic cell count. So that's, important to know about. The problem is that udder edema is complicated, and there's a lot of research potential available to figure out how to manage udder edema. We know that there's concerns with improper, whether too much, too little supplementation with protein, anionic salts, and minerals, and the potentially genetic risk factors, although the genetic component of it is thought to be quite low. But things to consider for sure would be related to diet and other things related to udder edema. But if we can reduce udder edema and manage that, we can also reduce somatic cell count. Okay, so the non-aureus staph or other staph species being protective is a huge area to consider. As I mentioned earlier, heifers have a lot of these bugs on their gland, and therefore we need to think about whether or not we need to control them, let them be, or maybe do something to promote them if they are truly protective. So this is some work from 10 plus years ago that looked at the cumulative incidence of clinical mastitis in throughout lactation in heifers. And this is heifers infected with major pathogens. So you can see that the incidence of clinical mastitis was much higher in heifers with major pathogens, which makes sense. If you have strep in your gland, you are much more likely to have a case of clinical mastitis. Non-infected udders were less likely than those that were identified major pathogens. But interestingly, heifers that had a non-aureus staph identified were reduced or less risk of clinical mastitis occurring than those that were negative. And so in this thought, it was thought that the non-aureus staph was potentially protective for these glands. There has been other work that's looked at this and also identified that potentially it's protective, potentially it's not doing harm is the other thing to consider. So things that we consider with regard to the protective aspects of it included that in the laboratory, when I grow bacteria, I can have the non-aureus staph inhibit the growth of major mastitis pathogens. So this is bacterial plate where we have a non-aureus staph plated on the back side of this plate. And then on the front side, this is Staph aureus. We are having no Staph aureus grow where the non-aureus staph is plated on the other side. So it's thought that some inhibitory substance is preventing the Staph aureus from growing, which is cool to see on a plate and potentially useful. But as we all know, with many things related to infections, when I can do it in the lab, it's cool, but I need to be able to determine if that can happen in real life and if it's positively impacting heifers or cows on a farm. So that part is to be determined. Some others have looked at this in mice, which I guess is a step forward to look at co-culturing with a non-aureus staph and Staph aureus. So this is just some bacterial loads. So the bacterial loads up the side of these bars. So when there's no bar, there's no bacteria present. And for example, this is looking at it in the first box, there's no bacteria presented, so there's no bacteria present, which is good. In the second box, you can see just Staph aureus was given to the animals and just Staph aureus grew as expected. In the third and fourth box, you can see that the animals were given Staph simulans, which is a non-aureus staph, and also Staph aureus. And in both of those cases, only the Staph simulans grew. So in that case, it was thought that the simulans prevented the Staph aureus from growing. Again, super interesting, but this is in mice, so unsure how that translates to heifers or cows. And it's a very specific strains of both the Staph simulans and the Staph aureus that were used. And we don't know in a field trial with real life, everyday Staph aureus that we see on dairy farms, whether or not these things would work. But it is interesting to consider. On the flip side of it, so while it's maybe questionable how protective these organisms are, or if that could be used on a dairy farm, we do know that non-aureus staph don't do a lot of harm. And so this is some data looking at first lactation cows with the Staph chromogenes intramammary infection. And as I mentioned earlier, Staph chromogenes is highly prevalent amongst first lactation animals. And you can see that the blue bars or the blue lines are the Staph chromogenes infected quarters, and the red lines are the healthy or non-infected quarters. And on the figure on the left, it's somatic cell count, and we do see some elevation in somatic cell count associated with a Staph chromogenes infection to about maybe 200,000 cells per mil. And while we see an increase in somatic cell count, we don't see a correlated reduction in milk production in those quarters. And so this you can see here, there's very similar milk production between the uninfected and the infected quarter with Staph chromogenes. And this is something that's been repeated and shown in other studies as well, that while it does cause a little elevation in somatic cell count, we're not seeing the corresponding reduction in milk production, which is something that has been in the mastitis dogma for many years of every increment increase in somatic cell count is correlated with a similar increase in reduction in milk production. However, in some pathogens, it seems as though that is not the case, and non-aureus staph seems to be one of those. And so, like I said, while unsure, debatable, working on whether or not it's protective, it most of the time does not seem to be causing harm. We do see cases where we have a case of clinical mastitis and we do grow a non-aureus staph. And in those cases, I still recommend treating those as a gram-positive intramammary infection and treating accordingly. But it seems that these subclinical infections maybe are not causing a problem. And I think it's important that something that researchers are still working on of like, is there differences in the different strains? Is some Staph chromogenes good and some bad? Some Staph similans good and bad? And that's something that we're trying to work out, that maybe there are some that are protective, but not all is that way. And maybe that would be helpful to figure out. Other things to consider with regard to prevention and control in general of heifer mastitis. So I think it's been made, the point has been made about hygiene management is important. So heifers sometimes are not as well watched as lactating cows. And so just making sure we're maintaining their environment in a clean, dry area is helpful. Pre-calving teat spraying might be helpful. In one study, there was an application of an iodine teat spray 3 times weekly pre-calving for at least 3 weeks, and it reduced the incidence of strep uterus. That was done in New Zealand as well. And clean teats probably do help with reducing mastitis. Obviously, some of these things get a little bit tricky because the management factors involved and the time and labor involved need to be evaluated at the farm level to determine whether or not that would be useful for a specific herd. Strep uterus can be quite devastating. It can cause a pretty elevated somatic cell count. So if that is a problem on a herd, this might be reasonable to implement because of the massive negative outcomes associated with strep uterus. Internal and external teat sealants have also been shown to reduce intramammary infections in heifers. This is one study of the percent infected glands in the control group and the teat sealant group. And you can see in general, the yellow is the all pathogens and the blue is the major pathogens. They did see a decrease in both, probably more substantial in the all, which would include the NOS species. But in general, we do see less intramammary infections if we use T sealants. Again, a management factor to consider whether or not that would be reasonable to implement on a farm. I put vaccinations as questionable. There's always mastitis vaccines being produced and evaluated. We know that E. coli vaccines can reduce the severity of E. coli mastitis, but management is still highly important for gram-negative pathogens. And so we can maybe reduce the severity, but we know that no vaccine can prevent infections. And so they're definitely not a replacement for management. Fly control is important, but also very important to consider integrated pest management. There's a lot of concern regarding pesticide resistance amongst fly populations. And so trying to use targeted management strategies is really important for fly control. Physical separation of older cows from heifers is something to consider. If a farm is having mastitis problems in their heifers and they do have them mixed, that would be important to think about. And then one that I get questioned a lot about is feeding mastitic milk and whether or not if we give young heifers, waste milk from older cows, are we then providing a route of colonization, which then could cause problems. So I think many times what people think is that if the milk has Staph aureus in it and the heifer eats it and then licks on herself, she's then spreading the Staph aureus around and getting it on her skin. I think that there's only one study that I can find. I've tried to find more about this, and I think it's something that needs to be further evaluated. But the one study that looked at it, they actually put Staph aureus in milk. This is it where they have the replicates and the treatments and the control groups, and they didn't find a difference in Staph aureus. So the treatment groups were in young calves, and then the heifers calving at 2 years of age are obviously they followed them over time. And there wasn't a difference between the treatment and control group of which group had more Staph aureus mastitis. So in this paper, they concluded that there appears to be little reason for concern for detrimental effects of feeding mastitic milk to calves in these specific conditions. I think that for this paper, it's a fair conclusion, but I do think there's more for us to think about. Like, for example, in this study, they used one specific strain of Staph aureus, and maybe it's different with different strains of Staph aureus. I also think there's more complicated factors regarding feeding waste milk. For example, if we think we have any mycoplasma in general in our herd, we should not be feeding unpasteurized waste milk to heifers either, because some pathogens can spread through that. Specifically, we know mycoplasma. Additionally, there's concern about antimicrobial residues. When heifers are fed milk with antimicrobials in them, it can potentially impact their antimicrobial exposure and antimicrobial resistance genes. And there's many layers to consider with regard to it. But at least this one study thinks that feeding Staph aureus milk is not a major risk. The other one to consider always is intramammary antibiotics in heifers. There are many, many studies that have looked at this of using dry cow therapy or lactating cow therapy in pregnant heifers to try to cure intramammary infections. And many studies have found that we could reduce the prevalence of IMIs. The thing to consider is whether or not it's necessary. Most herds, most of the infections in heifers are caused by non-aureus staph. And I don't think it's necessary to treat those infections in those heifers. They probably don't cause any harm. Most of the time they cure within the first few days of lactation, regardless of what you do. And so getting rid of those infections, I believe, is not necessary. And so I think that antimicrobials for those instances is not prudent. There's also considerations with withdrawal time. There's a recent paper that's looked at that a little bit in heifers, and that's the first one that has looked at withdrawal times, but using lactating cow therapy or dry cow therapy in heifers is extra label. Drug use and therefore withdrawal times need to be determined, and you need to work with your veterinarian to figure that out. I think if it's something that is going to be evaluated on a herd level, it would be in a herd that maybe has problems with major mastitis pathogens in their heifers. And in that case, I would recommend to work with a veterinarian to determine whether or not it would be prudent in your herd or maybe for specific animals. So some future directions that, we're trying to work on and continue to evaluate in heifers is maybe if non-aureus staph infections are useful, how do we promote them? And if we do promote them, does that provide similar protection as some of those natural infections that we see? When should management strategies be implemented? So it's easy for me to say, like, you need to keep your heifers clean, but also if a producer can focus on a time that's most important, if I can give some specific targeted time points, that might be more helpful for a producer. And then considerations for herds with major pathogens versus minor pathogens. What other factors are playing a role that maybe we haven't determined yet that are making some farms more at risk of major pathogens than others? So in conclusion, heifer mastitis is a major concern in many herds. Management is always a consideration for mastitis, a major consideration, and definitely in heifers as well. The heifer mammary health is related to the herd level mammary health, and so taking care of mastitis at all fronts is important. And considering environmental management strategies for your heifers is vital to trying to reduce infections in these animals. And with that, I included my email address for anybody who wants to send any specific messages to me, but I'm happy to take questions as well.
Thank you very much, Pamela. Excellent presentation. If anybody has questions, you can leave them in the chat, or we are a small enough group. You could probably just unmute yourself and feel free to share whichever you're most comfortable with. One of the things that I was thinking about as I was watching your presentation, and heifer mastitis is such an interesting topic because for all of the reasons you stated, it's not very easy to study.
Yeah.
But obviously has quite a big impact potentially on herds' overall milk quality. I'm curious, one of the things that I'm interested in is calves and stressful events in calves and how that impacts long-term outcomes, right?
Mm-hmm.
Is there any sort of data about like transportation stress or weaning stress or any of the dehorning stress, any of those early life stressors and how that impacts their risk of mastitis?
Yeah, I wish that we had that kind of data. I think that'd be really a great thing to look at. From a research perspective, sometimes it's challenging to find the team that's going to follow those animals for that long
Yes,
period of
I hear
time.
you. Yeah.
And I think myself, I've struggled with that. And so I think that's some of the stuff that we don't have figured out yet because we need to follow those calves. We need to be able to record different things that are happening on different farms, different stresses and risk factors. And so much of heifer mastitis has focused on the gestation period, but I do think that there are incidences that can occur earlier in life that are potential risk factors. I mean, we know that colostrum management alone can be a thing. So therefore, it's likely that other factors are important too.
Yeah. Yeah.
Sure.
I just saw Fred unmuted. Did you have a question, Fred?
Yep, sure do. I have a somewhat of a background on the beef side, and I saw a lot more beef heifers coming in with bad quarters from a mastitis issue than I have on the dairy. Is there a difference between beef and dairy? Are you seeing that, or have you looked at it?
Yeah, I mean, I work with a lot of beef cattle too on the clinical front of things, and we definitely see a fair number of heifers come in with bad quarters in beef, and I think some of it is maybe related to, environmental management of like heifers standing in ponds and things like that are risk factors we know. But have we looked at the specific risk factors in beef heifers? Probably not close enough. And also something that we're working on. I mean, we try to work on producers just evaluating mammary health in general and using that as a potential like management strategy for culling decisions in beef cattle. So I think we can make movements towards that as well.
I was just excited when you started talking about flies. I am thinking that's the most underrated issue we have with anything with an udder, that we just
Yes.
don't pay attention.
Yes, I agree. I feel like a broken record sometimes with regard to flies. And we have a lot of issues on our dairy farms here, and I just feel like fly management is a huge factor that doesn't get looked at enough.
Amen.
Yeah.
Any other questions from the audience? Either out loud or in the chat. Well, certainly we appreciate everybody who was able to join us today. Thank you, Pamela, for an excellent presentation. Again, her email address was posted at the end on the last slide there, or you can feel free to reach out to us if you're trying to get in touch with her. If you enjoyed today's program, or even if you didn't enjoy today's program, if you listened to today's program, go ahead and click on, there's a link in the chat to complete an evaluation. We really do use this data not just to continuously try to improve our webinars and our online programs, but getting a assessment of the impact of these programs is something that we report and helps us as we continue to justify extension as a whole and the work that we do here. So it might seem annoying to get all these surveys for everything you do, but we do actually really value your data or your feedback, and that helps us out quite a bit. So that link is in the chat. Feel free to click on that and fill that out. Thank you everybody for joining us today, and we look forward to season 3 next year of your Dairy Best Heifer webinar series. Thank you.
Thank you.
Thank you.